Thank you guys for having patience. I know it's kind of a lot when we have such a big class. But Betty, Professor Bogart is in Jamaica, so they're getting hit by a hurricane, unfortunately. So we may have to do this.
So when Ms. Bogart being in Jamaica, how does that affect us getting our grades?
So like as far as for the exam and
Yes.
thing. So I have access to her course. So, but both in ExamSoft and her Canvas course. So if she's still not got internet or something, I will handle that for you guys.
Okay, thank you.
Until she has it again.
And then we get answers about our grades Saturday.
For the exam.
Mhm.
Yes, probably Saturday. I'm not sure. We haven't all decided as a faculty what time we're going to get on and do item analysis, but yes, probably Saturday. Sometimes we'll do it Friday evening, but usually Saturday afternoon or so. Okay. Okay, hopefully it should start and you guys should be able to see and join, okay? You all can see my screen, correct? Yes? No?
We can.
Yes.
Okay, perfect. Thank you. So we'll do this for about 15 minutes. We'll stay on until about, let's see, 4:25. Okay. All right, we'll go ahead and get started. Okay, week 4, pediatric variations. Early detection of hearing impairment is critical. Which one is of primary importance? Reading development, relationship with peers, speech development, or performance at school? Which is primary importance related to early hearing detection? Speech development. Good. Yep. If they cannot hear, they cannot develop their speech the way that they need to be. Good. Okay, multiple select. Toddler playing outside gets a laceration on their forearm. He needs stitches. What can make this easier? Applying an appropriate numbing cream, get child life involved for distraction, restrain the child with mommy restraint, and let the child see the equipment for suturing. Yes, apply appropriate numbing cream before you're going to do laceration repair, okay? And then if there's child life involved, yes. Okay, why would we not want to show a toddler the equipment?
They'll get
They
scared.
might get scared.
They're going to see the needle and they're going to lose it, okay? If it was an older kiddo, you know, you might be able to show them the equipment. But a toddler, that's going to be hard to do. Good. Parent recognizes that their child Their toddler has speech delay compared to their older siblings. What's your nursing priority? Speech therapy, teach the child sign language, refer the child for a hearing evaluation, or explain all children progress differently. Okay, first thing to do if they have speech delay, refer them for a hearing evaluation. Okay, because if they're having troubles hearing and that's related to their speech delay, even if you send them to speech therapy, first, they're not gonna learn adequately because they have a hearing deficit. Okay. Good. Multiple select. What are signs of an early indicator of impaired cognition? Enhanced motor skills, unable to grasp objects at 7 months, non-verbalizing by 1 year of age, or behavioral difficulties. Yes. Not grasping any objects at 8 months of age, not verbalizing by a year. Okay. And then behavioral difficulties. Those can all be signs of earlier impaired cognition. Good. Child is being treated for a fever. The reason for treating the child's fever is what? Reassurance that the illness is temporary, prevention of life-threatening complications, relief of discomfort, prevention of a secondary bacterial infection. Why do we treat fevers? Discomfort. Okay. Fevers, when kids have fevers, they get really uncomfortable and fussy and just they don't feel well. So the main reason why we treat fever is to relieve their discomfort. Okay. Good. Okay, multiple select. Child is complaining of something in their eye causing tearing and pain. What's your nursing action? Look for any floating object and remove. Attempt removing penetrating objects. Apply a Fox shield for penetrating objects. Check eye for reflection to light. Good. Yes. Look for any floating objects and remove. Do not attempt to remove penetrating objects ever. Okay. In the eyes, especially. Okay. Apply a Fox shield for penetrating objects and then checking for reaction to light. Good. Separation anxiety in a child who is hospitalized. Which behavior indicates the stage of despair? Child demonstrates restrictive behavior. Child tells nurses and staff to go away. Child clings to the parent for comfort. Child is constantly crying and sobbing. Child demonstrates behavioral regression. Good. Yep. Good. Child with a history of abuse. Which therapy explores emotional problems? Creative expression, therapeutic play, dramatic play, play therapy. Play therapy. Okay. Therapeutic play and play therapy, I feel like, are similar options. So I think if you pick either one of those, you're correct. But it was asking specific for the type of therapy. So play therapy would be the type of therapy. Okay. Good. All right. Multiple select. When can children react to the stress and anxiety of a hospitalization? before they're hospitalized, children do not have stress towards hospitalization, only during hospitalization or after they go home. Remember, this was multiple select. Good. Before they're hospitalized and after they go home. Good. An adolescent goes to the ER for treatment without parents. How do you get consent for treatment? Client that is 18 and deemed competent may sign their own consent. The visit is considered an emergency, so no consent is initially needed. 2 witnesses, telephone consent from a parent or a guardian. Any child 18 or older with proof of age may sign consent. Good. Yes, client who is over 18 and deemed competent. So if they are totally incapacitated because of their injury, they cannot sign their own consent. Okay. Yep, it's considered an emergency, so no consent is needed initially. And then 2 witnesses via telephone can get a consent from a parent or a guardian. Good. Child is extremely fearful of hospitalization. What type of play explores these fears? Dramatic play, cooperative play, diversional play, solitary play. Dramatic play, because you're playing out their hospitalization fears. Okay. When checking an IV on an infant, you notice that the tissue around the IV is swollen. What's your first action? Flush the IV with saline, stop the infusion, place a warm pack on the site, or elevate the limb. Yep, good. Stop it. In helping a child to adapt to a hospitalization experience, the best approach is what? Bring in toys to represent a familiar environment. Bring food from home. The child selects his room on the unit. Establish a daily routine and keep consistency. Yep. So daily routine. So they know what to expect throughout the day. That will help alleviate their anxiety about the hospitalization. And if you can try and keep it as close as you can to their usual routine at home or at school or daycare, that would help them even further. When assessing vision on a child, the healthcare provider would use the Snellen chart at what distance? 15 feet, 20 feet, 25, or 30 feet? $20 feet. Yep, good. Multiple select. Nursing care of discharging a child to home. Provide written instructions to only the parents. Provide a list of emergency telephone numbers. Explain expected outcomes. Ensure that the parents understand discharge instructions. Yep, provide a list of emergency telephone numbers, ensure that the parents understand the discharge instructions, and explain expected outcomes. Why is the red one incorrect? The provide written instructions only to parents.
Is it because you want to explain things to the child too to make them feel involved?
Yep, and you want to do written and verbal usually, right? You want to talk them through it and also give them written instructions. Good. Perfect. Okay, what is a 3-year-old's biggest stressor of being hospitalized? Fear of mutilation, fear of strangers, separation from parents, fear of pain. 3-year-old, so toddler age. Yep, fear of separation from their parents. Good. Okay, multiple select. What is the best way to alleviate the stress and anxiety of a hospitalized child? Keeping the child on their same routine and rituals. Explain procedures using developmentally appropriate terms. Allow the parent to stay with the child. Perform all invasive procedures in the child's room. Yep, good. Keeping the child on their same routines and rituals, explaining the procedures, developmentally appropriate terms, and allowing that child to stay with the parent. Why would you not want to perform the invasive procedures in their room?
Because that's supposed to be a safe space.
Yes, good. So if you have the availability to do those things in a procedure room or something like that, then do that instead. Good. The nurse notes a string tied around an infant's wrist. An appropriate intervention would be ask the parents to remove the string, report to social services for child endangerment, ask the meaning of the string and leave the string in place, have the parents remove the string, it is dangerous. Yes, good. Ask the meaning of the string and leave it in place. Good. Which urine collection method on an infant is most accurate? Bag urine, clean catch, straight calf, catch urine midstream. We're kind of all over the place with that one. Okay, an infant. Are you going to be able to do a clean catch on an infant?
No.
No. That's going to be, well, you might be able to if you just so happen to like clean their private area and set them over a little specimen hat and catch it, but pretty unlikely. A bag urine, think about all the skin tissue and skin cells that go into that urine because of the way that the bag has to be placed on the skin. Okay, so that's going to throw off your urine result too. So the best way to do it is straight calf for infants. Okay. Older kids, you can probably get them to do a clean catch if they're potty trained. But if they're not potty trained and you're concerned about a UTI or something, straight calf is what you're going to have to do. Okay. If you don't need a totally clean urine, you can use a bag urine. But if you're concerned about a urinary tract infection, you have to use the most cleanly technique, which is straight calf. Okay. Do a couple more of these. Okay, multiple select. What is the purpose and function of the family? Providing a safe environment for growth and development, ensuring financial assistance for family members, providing emotional comfort and identity, transmitting values, attitudes, and beliefs. Yes, providing a safe environment for growth and development, providing emotional comfort and identity, and transmitting values, attitudes, and beliefs. Good. The primary goal of caring for the child with cognitive impairment is to develop vocational skills, help the families develop care plan and have them stay with it, encourage play, promote optimum development. Yep, so your goal is to promote their optimum development. Allow them to continue functioning as well as they can with whatever type of interventions that they'll need. Okay, this will be our last one, unless you guys want to stay on longer. Many infants require oxygen. What type is best tolerated and accurately delivered? ET tube, nasal cannula, tracheostomy, oxyhood. Oxyhood is actually the most accurately delivered. Okay. Alrighty. Any other questions? No? Alrighty, you guys can head out. If you have any questions, let me know, okay? For now, those of you that are in Professor Bogart's class, you can email me. I will let you know. And she will let you know if she ends up not having any troubles, okay?
Thank you.
Yep, you're welcome. See you guys later.
Thank you.
Oh, and the grades will be posted.
Saturday is what we talked about.
This Kahoot is gonna be sent to us?
Your Kahoot should be Professor Bogart should have it in her announcement. For week 4 information. She puts it in the same spot that I do. So that's where it should be for you. If for some reason it's not there, you can just message me and let me know and I will put it there.
Okay, thank you so much.
Yep, you're welcome. Okay, Mackenzie.
Yeah. Exam Self told me, basically it's it's issue with the school since it's my like verification, and my IT person
Okay.
never got back to me. So I think I have to just go early in the morning tomorrow and just not
And
sure.
talk to them about it.
Yeah, because it's not. He told me he would get it changed over, but I kept calling, and then eventually the front desk lady told me he stepped out for a second.
Okay.
So I
Okay.
don't really
Darn
know.
it. Okay. That's okay. I'm helping proctor a couple of exams tomorrow night, evening time.
Mhm. Like 8.
Yeah, the 8 p.m. Eastern time frame.
Okay.
So the other option would be, I don't know if you guys have, what campus are you at? Can you
The Columbia
Okay, does Columbia have any in-person
proctors.
yeah, that you can use?
I think their policy is you have to set it up 42 hours ahead of time. So I'll just have to do
So
the
that probably won't work. Okay,
yeah.
that's okay. So what we can do, oh here, let me stop the recording because we don't need this on here.